Hi everyone. Today in this video I want to discuss how I've evolved treatment to combine two very specialized therapies into one. And as a trauma therapist, I have to work with therapies that are very, very powerful, that really respect the neurobiology of trauma and addiction. Both of trauma, addiction, eating disorders, powerful anxiety disorders like phobias and things like that, all really have to do with an implicit memory system. It's a defense mechanism in the brain where it's stored in the lower limbic region of the brain. But basically what happens is the brain creates a filing system for memories that we need to hold on to protect ourselves, and they act as triggers. They act as filters that filter our current space, trigger the same emotional reactions we had when we originally created these memories, and this creates us to go into like a fight-flight, in that way protects us even in the present moment, even though we may have originally had the distress as a younger person, and we may have grown up and not need these defenses anymore. The brain kind of gets stuck doing this with this implicit memory system. It doesn't have a way to release these memories, and so specialized therapies like EMDR, which uses bilateral brain stimulation, or hypnotherapy, both relax the amygdala, which guards these memories and protects them and keeps them in their protected format. By putting that amygdala aside, we can actually deconsolidate these frozen memories, work with them, change them, desensitize them, and thus release memory from that frozen state so that those filters then don't exist. And this gives us permanent relief from those anxious, depressed, or addictive symptoms. And addiction is the same, works exactly the same way, as the same neurobiology as trauma, with the exception that it has a switch involved that creates dependency. And we can switch off that switch by just targeting these memories in the same way we would target trauma. Their addiction is implicitly stored memory. So we need to clean out that implicit memory track, and EMDR is probably the best way to do that. So I've become a big fan of EMDR. I've become certified, a consultant, and eventually regional coordinator for my region for a long time, and now I've kind of pulled away from that administrative function, but still have my hands in advocating for EMDR services. I recently, a couple of years ago, got certified in hypnotherapy, and have as well added that to my toolbox. I also do brain spotting as well. But what's evolved recently is the realization that EMDR isn't a perfect therapy. It has its deficits, and one of the deficits is Hypnotherapy Strengths. One of hypnotherapy's weaknesses is EMDR Strengths. So I found that by merging the two together, I could realize the strengths of both. So let me just itemize what those strengths and weaknesses are. So EMDR is the king of desensitizing fear and shame. If there's fear and shame present, I'm going to start with EMDR, because that is absolutely the go-to therapy for fear and shame. Also, for addiction, I don't think there's any other therapy that beats EMDR for addiction. And what I like about EMDR in processing anything, for everything that I use it for, is that we can go and see if there's an implicit memory system, which is usually filing system for implicit memory is by association. So if I have an event where I feel I'm not good enough, then all the memories regarding I'm not good enough will be processed as I open those memory channels up. So it can process 10 years of memory in 1 hour, all associated with I'm not good enough. That's how EMDR works. And the brain just automatically does this. It's not like I or the therapist doing EMDR does anything to bring those memories out. The person who's sitting there, you, the patient, if you're the patient, just focuses on and feels the memory. We just activate that memory and bingo, the brain starts releasing all these memories. And it clears out channels of memory that have been stored possibly for a lifetime. So this is just so wonderful, a strength of EMDR. Hypnotherapy does not do that. Hypnotherapy works on what we're presenting and the healing and the catharsis from the deep release of emotion that happens with hypnotherapy, which is so amazing, doesn't really tap into the associated channels of implicit memory, even though we do have the amygdala out of the way. So EMDR has the benefit and strength of processing long-term storage of memory to make sure those channels are clear. But what I found as a weakness of EMDR is that there are things we shouldn't desensitize. EMDR advocates in their training that we keep going with EMDR, that we process our way through everything, and basically we're desensitizing everything. And there are things that we shouldn't desensitize. And I've learned this through my practice and through the work with hypnotherapy, especially. I've learned that there are emotional states that really serve healing, a purpose of healing, and they in releasing them and expressing them create what's called a catharsis. It creates a change, and the change is in the direction of healing. And I found that in some cases, my EMDR clients did not complete therapy until I actually did hypnotherapy with them. And then in one session, bango, they resolved. And the reason for that was because we handled specific emotions differently. And those emotions are anger and sadness. Anger serves to re-empower us. And if we desensitize anger, we don't give the person a chance to feel re-empowered. And so if we really dig into that anger as we would in hypnotherapy, and we give them the tools to release and express anger so fully and cathartically, an absolute switch goes off and a change happens. And then we may see sadness and grieving come up, and the sadness and grieving also serve a cathartic purpose when expressed and released, and that is to let go of what happened. We're grieving the lack of love or attachment that we're realizing, and we're realizing that it wasn't my fault, so we get angry when we realize it wasn't my fault, and we release that anger, and then we become sad that we weren't loved the way we needed to be loved, and we need to grieve that to let go. So that grieving is really important. We don't want to desensitize grieving or sadness. It doesn't serve any purpose to do that in healing. So I turn the bilateral stimulation off, and we switch to a hypnotherapeutic technique. And if I'm doing hypnotherapy and fear comes up, I will add bilateral stimulation to that, or shame, because I know that I can help the person master their way through those emotions with bilateral stimulation, perhaps better than any hypnotherapeutic method, though I have methods to release those through hypnotherapy as well. I just take the best of both, put them together, and it's almost seamless. The wonderful thing about the EMDR model, the 8-phase model, and the hypnotherapy, I use a heart-centered model. These two models allow for other things to interface with them seamlessly. They're such beautiful models. They've both evolved over time, and they are really in perfect states for this to happen. So I've been combining these two therapies to have an idealized state of perfect therapy that covers all the bases, does everything we need to bring people to resolution by combining these two together. For more information, see me at my website, herbcohen.one, as you see below. And if you like this video, hit like on my YouTube channel. Thank you for watching.